Good. This is a reminder for all of us to put our phones on silent. Thank you very much. Cool. All right. Hello, everyone, and welcome. My name is Allie Cronley. I'm the director of the United Homecare Workers of Pennsylvania, the largest caregiver union in the state. And we are proud to represent tens of thousands of healthcare workers across Pennsylvania. I really want to thank Liberty Home Choices, which has been a major home care provider in Philadelphia for over 40 years and a leader in the disability rights movement, for hosting us here today. And thank the Pennsylvania Health Access Network, which is the leading patient advocacy organization in the state, for joining us. Last week, the House of Representatives voted to pass the largest Medicaid cut in history, which would strip Americans of $625 billion in Medicaid funding. In Pennsylvania, we would lose $3.4 billion each year in care. And now these disastrous cuts are moving to the Senate, who are our last line of defense to stop this unprecedented attack on the most vulnerable people in our communities. Let me be crystal clear. These cuts, if not stopped, will be catastrophic to home care in our communities. Thank you. The harsh reality is that access to high-quality home care in Pennsylvania is already under severe threat. Most home care workers, and you'll hear from several today, enter this profession out of a deep desire to help others. The overwhelming majority of seniors and people with disabilities prefer to receive care at home and deserve to be independent in their communities. However, funding for this critical work is already far too low, resulting in unlivable wages and an extreme lack of benefits. On top of that, the nonprofit home care agencies like Liberty Home Choices that choose to invest in their workforce and prioritize quality care all too often find themselves competing to survive with agencies that engage in wage theft and other serious labor abuses. As a result, too many high-quality caregivers leave the profession, and too many seniors and people with disabilities are threatened to go without care. It doesn't have to be like this. Another way is possible. In states across the country, home care workers have organized, together with allies in the disability rights movement and seniors, and won the resources it takes to make home care jobs high-quality jobs. From California to Massachusetts, from Oregon to Illinois, home care workers make above $20 an hour, have access to quality training, to health benefits, to paid time off, and to the secure retirement. Benefits that most care workers in Pennsylvania just dream about. Instead of debating the best way to bring good jobs back to the U.S. from abroad, we should be investing in our caring economy and working together to make the jobs that we have here now into good jobs. Protecting Medicaid is critical to investing in our caring economy, while also ensuring the most vulnerable among us are able to live in our communities with dignity. If these cuts go into effect, it will have extreme consequences on 65,000 Philadelphia County residents who currently rely on home care. The already scant access to home care would dramatically decline, sending individuals to nursing homes or assisted living facilities at a time when they are already underfunded and stretched to the max. Our Commonwealth population needs more care more than ever, and cuts of this scale are a matter of life and death. There's no one in Pennsylvania that wouldn't be impacted. These are our family members, our parents, our children, our friends, our neighbors. All of them deserve quality care and the dignity to age in place. Ripping away their safety net so that politicians can give tax handouts to billionaires and mega corporations is shameful. Senator McCormick and Senator Fetterman are our last hope to stop this. In particular, we're calling on both senators to strongly oppose provisions that would implement burdensome work verification requirements. The vast majority of adult Medicaid recipients under the age of 65 already work, like our home care members, who are paid to keep working through Medicaid waivers and other programs, and the rest are students or family caregivers who cannot work due to illness. Other states that have tried to implement work requirements have ended up wasting tens of millions of dollars on red tape and mistakenly kicking people off their health care. Senator McCormick, Senator Fetterman, you must vote no on these morally corrupt cuts. Stand up for home care and stand up for the health security of all Pennsylvanians. Now I'd like to introduce our first speaker. For more than 30 years, Tom Earl has championed the rights of people with disabilities. As the CEO of Liberty Resources, he has proven that it's possible to build a mission-driven home care agency to deliver high-quality care while also investing deeply in the workforce and ensuring caregivers have a seat at the table with their union. Pass it to Tom Earl.
Good afternoon, everyone. I'm Tom Earl. I'm the CEO of Liberty Resources, the Center for Independent Living for the Philadelphia, southeastern Pennsylvania area. We proudly provide services in Philadelphia County, Delaware County, Chester and Montgomery counties, and an integral part of our independent living work for people with disabilities is to ensure that they have access to home care, to help them with the activities of daily living that some folks need and just need to get out to work, part-time or full-time, and help them get out the door and part of their community instead of being placed in an expensive, segregated nursing home setting. In Pennsylvania, we have struggled for the past several years to get increased funding for these valuable services and have faced a lot of challenges. The time is now not to be entertaining Medicaid cuts to a system that is already broken in many regards. Too many caregivers leave this important work to work in other sectors such as Amazon, UPS, Sheetz, or Wawa, where they're paid $20 an hour and receive health care benefits. We want to make sure that these services in Pennsylvania are sustainable. And we really hope that Senators Fetterman and Senator McCormick hear our voices, hear our united voices, that the time is to vote no on any further cuts to Medicaid. This system needs help, not harm. And you'll hear from many speakers today that will talk about the challenges that they currently face under the system. It should be funded properly at a rate that sustains the need for these services and recognizes the value that caregivers put on the line every day to help people with disabilities live independently. I want to pass the mic back to Allie Cronley. And we stand united with United Homecare Workers of Pennsylvania, SEIU, and all of the advocates who are pushing for an improved system for home care.
Thank you, Tom, for those powerful words. Next up, I want you all to hear from an incredible caregiver here at Liberty Home Choices, the leader of our union, Ms. Monica McDuffie.
Hello, my name is Monica McDuffie.
Hello.
I'm a home care worker and a nursing student and have been working in home care for 6 years. Before that, I cared for my grandmother who was living on hospice at home. My experience caring for her and her lifelong battle was very hard, but I also had one of my own. My experiences caring for my own medical conditions became my passion. I've been ill since birth. I was born with a rare organ condition that makes my respiratory system very weak. It has caused lifelong need for frequent, ongoing medical attention. I rely on Medicaid to cover the many specialists, doctors, and appointments it takes to keep me alive. Without Medicaid, it would be impossible to maintain my medical care or see doctors when I need to. I would die without Medicaid. This vote in the Senate is about life and death for me and the people I care for. I have a consumer in a wheelchair right now who will not be able to make it if she loses the home care services her Medicaid provides. She relies on me every day for hygiene, to eat, to take her to the bathroom, and have something as small as being washed done. For her, home care means feeling like a person. If she has these services taken from her, she'll be left to sit in her home in extreme suffering. People in home care rely on us to stay alive. Nursing homes are not an option for her or many others in home care. I care for a father with incurable bone marrow cancer. Medicaid covers his medications, including pain medications, that allows him to continue to live in his home with dignity. Without his medication, he will not survive. These cuts are a slap in the face to working people and to the disabled. They will take our jobs and take the only support our care consumers have. If these Medicaid cuts go through, it will be one of the worst public health crises of our lifetime. Possibly even worse than a pandemic. It will be people with HIV who can no longer afford their medications, people who will starve to death. There will be a mass death of people who are sick and disabled. To Senator Fetterman and Senator McCormick, don't vote to put people in their coffins. Protect us, protect our benefits, and protect our livelihoods. You made promises to protect and represent us. Stand up for the people. Vote no on the dangerous legislation to take away Medicaid.
Ms. Monica, thank you so much for your powerful story. Next, I'm going to pass it to a longtime ADAPT activist and consumer here at Liberty Home Choices, Ms. Dominique Howell.
Hi, everyone. Thank you for coming out and hearing our powerful stories. As stated, I am a consumer and I am an activist and an advocate. And more importantly, I am a person who receives Medicaid, and I'm a mother whose child receives Medicaid. And without Medicaid, I would not be able to be the productive member of society that I am. I would not be able to work. I would not be able to care for my child, as many other Philadelphians and Pennsylvanians and people across the world, across the United States are experiencing. And I would like to say that it is important to note that in Philadelphia alone, we are a population of 17%, which equates to 246,000 people with disabilities. And so even though the number that was mentioned before was 65,000 people receiving home care, that could triple when Medicaid is cut. And so what are we going to do? Let them die? Let them go into nursing homes? That's impossible. That cannot happen here, and that should not happen anywhere else. Thank you.
Thank you so much, Ms. Dominique. Next, I'm going to pass it to another caregiver, Crystal Spivey.
Good afternoon. Good afternoon, everyone. Thanks for coming. Everyone here is here to support Medicaid cuts. Cannot afford this right now. So hopefully, Crystal Spivey. I'm a CNA at Liberty. I've been in healthcare since 2009 and been in home care with Liberty for 8 years, as well with my union, SEIU of PA. We have a second chapter for Abraham, so I'm in that union as well. I've worked in a lot of nursing homes, and I chose to enter home care because of the difference it makes for the people we care for. In nursing homes, folks often cannot get the support they really need. Home care allows people a chance to have more individualized care within their communities. I make sure I care for my consumers have support in every area of their lives. I make sure they eat, they take baths, they go to their public, their transportation, to doctor's offices, or wherever they need to go, medicine, laundry, making sure that their house is clean, whatever they need done, I'm there. Some are seniors, some are disabled, some are having health crisis. For all of them, home care is essential to ensuring they stay alive. I am their eyes, their ears, their feet, and shoulders. I do this work because I care deeply about the people I care for. It breaks my heart to see the president dismantling everything that we fought so hard for. The sad fact is that unless the Senate votes to stop these cuts, it's going to destroy home care as we know it. And that is going to be very hard for the people who depend on me. I care for quadriplegics and people who are amputees. Some people I care for are in their hundreds. I wash their feet, I wash their legs, I make sure they eat, take their meds, make sure that they're warm, they're comfortable, and watched over at night. It's a blessing to be in their presence. They have they have wisdom, they have strength, and they're still human. I rely on Medicaid for my own medication. People have medicines they rely on taking in the morning, afternoon, and at bedtime. How would they afford it without Medicaid? I want our senators to understand what losing Medicaid will do to entire families and communities in the state of Pennsylvania. I have a son who has autism. He needs his Medicaid benefits. I have a grandmother who is 88 years old and is on Medicaid. These cuts could leave her without no medicine for her heart conditions. My mom and my father, they have mental disabilities. What would they do if they lose Medicaid and can't see the doctor to get their medications so they can function? Senator McCormick and Senator Fetterman, don't let Donald Trump and his administration dismantle our Medicaid. Take action for the people who elected you in office, who you swore to serve. Vote no on these cruel, ignorant, and inhumane Medicaid cuts. Thank you.
Great. Next, I'm going to pass it to a friend, the chair of the Consumer Workforce Council, Mr. Guy Anthony Brooks.
Thank you. As you can see, I am a person with a disability sitting in a wheelchair. 15 years ago, I was transitioned into an institution for care and services, which did not happen. I got to find out about Liberty Resources through information where I came speaking to them, letting them know that I did not like it in an institution. So they assisted me into transitioning out of an institution into an accessible, affordable home in the community, which is integrated in the community. I am an activist with ADAPT, ADAPT. I am a Consumer Workforce Council member. I am the chair of that community. We relate with the sales and the union to give us care in the community. Without Medicaid, I would lose everything, my medications, my care in the home, my personal care attendants, some of them who are standing beside us, who are with us in here, some of the sale workers who are here, just like the CEO of the sale. If we lose Medicaid and we are transitioned back into an institution, it's not a place I would like to be, and it's not a place anybody else who is living in a community, independent, doing what they need to do, than being stuck in an institution where we go and do not believe but believe it, we die in an institution. I have lost friends in an institution, and that's why I am here advocating and being an activist to let the senators know, as we are all saying, no to the cuts you are doing, because it would affect all of us who are living independently in the community. Thank you.
Mr. Green. Last, I'm going to pass it to Mr. Bill England from the PA Health Access Network. The PA Health Access Network works every day to expand and protect access to high quality, equitable, affordable health care for all Pennsylvanians.
Thank you, Ally. Can you hear me without this?
Yes.
Yes.
Good afternoon. My name is Bill England. I work for the Pennsylvania Health Access Network, and it's wonderful to be here with our partners from SEIU and the workers. And it's an honor to be here with these advocates who are constantly working hard just for the right of independent living, the right of civil rights, to be able to be a contributing member of society and to live their lives. Pennsylvania Health Access Network is the only statewide patient-driven organization working to expand and protect access to quality care, high quality, equitable, affordable health care for all Pennsylvanians. We've been making progress in the right direction over the last number of years with the expansion of Medicaid, with the marketplace and Penny. We have seen the rate of people who have no insurance drop from 12% to 5%. And we've seen uncompensated care costs drop by over 25%. That's going in the right direction. This proposal takes us in the wrong direction. Medicaid works for Pennsylvania. It's a proven, efficient, and effective program that keeps Pennsylvanians healthy. 3 million Pennsylvanians rely on Medicaid for health coverage. That's nearly 25% of the population. Of those, 42% are children, 33% are seniors, pregnant persons, or persons with disabilities. Medicaid is a top funder for critical services here across the Commonwealth, like mental and behavioral health services, community health care, school nurses, substance abuse disorder treatment, community health centers, rural hospitals, rural health care, in-home care, and nursing homes. Medicaid is an investment that keeps growing. Medicaid allows low-wage workers to work. It creates jobs, boosts small businesses, and generates economic growth for the Commonwealth. The proposed budget that was passed in the House last week would make significant cuts to Medicaid that would likely cost Pennsylvania $2 to $4 billion a year. This would leave children, seniors, persons with disabilities, and working families without essential services and life-saving care. No matter what form these cuts take, they would affect everyone in Pennsylvania, not just those enrolled in Medicaid. Without the funding that Medicaid brings, Pennsylvania will see increased health care costs and wait times, new tax burdens, lost jobs and economic opportunities, and sustained pressure on state and local budgets trying to make up for the loss. For those who need home care, Pennsylvania residents are covered by Medicaid, and Medicaid funding is critical to ensuring high-quality, safe care for all enrolled. Cuts proposed will hurt millions of Pennsylvania receiving quality health care, in-home care, and be able to have independent living. More than 3 million residents in the Commonwealth rely on Medicaid for their health care, of which 324,000 are likely to lose their care if this is passed. Over 500,000 people are enrolled through Penny, the marketplace. A decrease in the enhanced tax credits will leave more than 167,000 working people unable to pay the difference if the tax credits are cut. We estimate that over 600,000 newly uninsured Pennsylvanians. Cuts to federal funding will be $2 to $4 billion. This will lead to an estimated $700 or more million per year in uncompensated care. This will cause a massive strain on our healthcare system, which is already under strain. Medicaid is important to the financial stability of most hospitals, but for most hospitals, it's a lifeline. These hospitals are often in communities with a large number of Medicaid patients who rely on Medicaid payments as a core for their business. Additionally, many of these hospitals are struggling financially. We've seen a number of closures recently here in southeastern Pennsylvania. Changes to Medicaid funding would force states to reduce or limit payments to these hospitals, worsening their existing financial vulnerability. It's also about lost jobs. Over 61,000 jobs, that's 27,900 healthcare jobs, and more than 33,000 jobs in other sectors created as a result of Medicaid expansion are now at risk. States like Pennsylvania have expanded the Medicaid program and have historically and consistently experienced growth in the labor market. This growth occurs in both the healthcare industry as well as related jobs and in the community. This affects large businesses and corporations and mom and pop shops in our neighborhoods. Medicaid works for everyone. That is true, and cuts to it are going to affect everyone. This is the wrong time and the wrong direction for this kind of change. We call on Senators Fetterman and McCormick to do the right thing for Pennsylvania and to vote no on these historic and horrible cuts. Thank you.
Thank you, Bill. That was a devastating series of facts. So, if that made anybody in this room mad, we're gonna come in for a landing here, but wanted to ask people to take some action. Take out your phone. Take out your phone. So I'm gonna give you a number that you can call to tell our senators, McCormick and Fetterman, to vote no on the Medicaid cuts. So 866-426-2631, no matter where you're from. That will connect you to them. We need you to call it today, call it tomorrow, share it with your friends. We need to make sure everyone in our community is calling and encouraging them to vote no on the Medicaid cuts. And just on behalf of the tens of thousands of healthcare workers we represent across the state, on behalf of the consumers here at Liberty Resources and all people with disabilities, we urge Senator Fetterman and Senator McCormick to put the health of their constituents over special corporate interests and vote no on this vicious anti-American attack on working people, caregivers, and our healthcare.
Can you repeat that number?
And the number again, great, so call it today, call it tomorrow, 866-426-2631. That's our press conference for today. So really want to appreciate everybody for Liberty for hosting us and everyone for being here and attending. Thank you. And if folks have one-on-one questions or want to talk to anybody, you should feel free to do so as well. Great job, you. Thank you.
Thank you, sir.
Thanks, Bill.
Great work, everyone.
Great work, ladies.